Hi there, I'm Dre, host and founder of the Dragon Network. On today's video, I'd like to talk about some of the benefits from documenting workflows or process flows within the healthcare environment, and more specifically, what those benefits are in relation to our health IT work. I'm sure a number of us have been in a situation where we take a look at a workflow and think, I could probably improve that, or that could be more efficient. And a lot of times, you're not quite sure where you should start with trying to figure that out. In most instances, the best place to begin is actually by reviewing the workflow that's been documented to outline what those process steps are. If you don't have the workflow documented or the documentation seems to be quite out of date, then making sure that's updated is your first priority. So I'm sure that you've probably heard before that documenting workflows is very beneficial to the organization, and it's something you should strive to do and to keep up with. But there are a lot of organizations, and in particular healthcare organizations, that struggle to actually document all of their workflows. And this is primarily because it's an enormous amount of work. There needs to be some sort of balance between the workflows that are documented and the level of detail that's included and how you're going to utilize those documents. I'm going to go over the 10 key benefits that I've seen in documenting workflows so far in my career, and I'm hoping that by sharing these with you, you might be able to leverage some of this information to encourage others within your organization or to motivate yourself to get started with documenting or updating the documents. So number one, role definitions. In order to document your workflows, it's important for you to define all of the participants or actors that are going to have process steps or interact with the particular workflow. And by doing this, you can shed light on a number of things that you may not have realized earlier, such as how many individuals are interacting with a particular patient path or what roles those individuals have. The second one we have is clarity. So having things documented actually improves the clarity we have in process steps throughout the organization and reduces the amount of confusion that you may have in a particular area or with a particular department or group. So this clarity can actually be incredibly beneficial when you're looking at things like communication or change management or just your general day-to-day operations. So the third key benefit I see is training material. If you have your workflows documented and they're documented accurately, you can actually leverage the information that's contained in those documents to help build your training scenarios or your training materials. So it is very beneficial, especially in a clinical space, to have training materials focused on a scenario so that people can sort of understand and relate to things a lot easier. And if you have the workflow documented, this can serve as the base for creating that training material. If you don't have any workflows documented, creating those scenarios will tend to take a lot longer and might not be in line with what people are actually doing. So number 4 is bottlenecks. So if you have something documented in a visual flow diagram, it's a lot easier to see where bottlenecks in the process may be coming into play. So without that visual representation, if you're just going on assumptions or just going on verbal statements, it's difficult to understand where the process might be getting bogged down. Number 5 is IT opportunities. So by having a workflow documented in a step-by-step manner and having the roles of individuals identified as well as the systems that are in play, you can actually spot opportunities for IT improvement. So you can see areas where there may be potential duplication in data entry, or you can also sometimes see areas where you have a particular role that is performing a step that could or should be performed by someone else. So you may also see in particular workflows, if there are a number of manual process steps, opportunities for functionality to be implemented or automated type workflows to be put into place. Number 6 is resequencing. So by looking at a workflow in a documented visual format, you can actually start to see whether the sequential path of activities is the most efficient path for the outcome you're looking to achieve. You can sometimes tweak the sequences a lot easier or have discussions around whether there are opportunities to improve that sequencing to gain further efficiency. So number 7 is communication, and this is one that not a lot of people think about. So if you have the patient or patient caregivers or family members identified in your workflow and there's interaction between those groups, you can actually see where the communication is taking place throughout the entire process life cycle. So you can see how frequently the patient's being engaged, how frequently family members or caregivers are being updated, and you can actually begin to assess whether those communication points are happening at the right time and whether or not there's enough frequency for them. So by looking at this in a visual flow and by actually understanding where those occur in the process, you can often make adjustments to the workflow to actually improve the patient and family satisfaction across that process. So number 8 is policy needs. By having a documented workflow and outlining the steps that are taking place, as well as the individuals and the areas that are actually interacting throughout the flow, you can identify areas where organizational guidelines or policies may need to be included or updated. It's very difficult to see sort of when policies are coming into play or where guidelines may assist with efficiency if you don't have something written down. But as soon as you actually can lay it out and to see sort of where it flows, by looking at those bottlenecks, those efficiency opportunities, the roles, the resequencing, you can actually also start to see where you may benefit from having some more parameters around what's actually taking place. So number 9 is performance. By actually discrete process steps documented and outlined in a sequence, it's a whole lot easier to measure whether the efficiency and performance of that workflow is optimal. So you may have heard the term, you can't measure what you don't understand. Think of the workflow documentation in terms of understanding what's happening. And as soon as you have pen to paper or you have that visual diagram that's actually outlined, you can start to measure from an efficiency perspective and a system performance perspective where the timings are between each of those individual steps. So last but certainly not least is change management. So if you have documented workflows that are actually up to date and correctly reflect the workflow that has been decided or the workflow that is being performed across the organization for a particular process path, it is a lot easier to communicate and incorporate changes to that workflow. One of the most important things with organizational change management is the communication that's going to take place. And that communication often relies on knowing what the current state is, as well as what the future state is going to be. So you're going to, with your organizational change management efforts, actually talk about the differences in between and describe it to the individuals that are being impacted by the change in terms of what's going to be different. If you have everything documented and you have the ability to update those workflow documents to reflect the future state, then it gives you one more layer of communication tool that you can actually utilize. So you can visually show them what it is that's going to happen on the piece of paper. You can walk them through it step by step. And you can also, as I mentioned earlier, incorporate all that information into any training and communication activities that are associated with your OCM efforts. So I hope you found those 10 reasons helpful. And if you're in situations where you're having conversations with team members, with project groups, or with your organizational leaders around dedicating efforts to documenting workflows, I hope that these 10 factors will help that conversation. So thanks for joining me today. If you haven't hit that subscribe button yet, go ahead and do so. And if you like this video or others that I've posted, let me know in the comments and don't forget to hit that like button. I will see you again next time.